See of the room. Okay, very good. All right, so we're going to set that up. All right, and scene. All right. Good morning, Mr. Richardson. My name is Tilia. I'll be your student nurse today. We're going to be doing a quick head-to-toe assessment. Is that okay?
Sounds perfect.
Great. All right. So first things first, I'm just going to go ahead and provide for privacy, do some hand hygiene. I'm going to clean my stethoscope here with an alcohol wipe. May I see your wristband, please? Can you provide your name and date of birth for me?
Joshua Richardson, April 15th, 1999.
Very good. Thank you very much. I'm just going to ask you a few questions to start out here. Can you tell me where you are today?
Doctor's office.
All right. Do you know what day it is?
It is Thursday, July 16th, 2026.
And why are you here today?
For a head-to-toe assessment.
All right. And can you just verify your full name one more time for me?
Joshua Richardson.
All right. Patient is alert and oriented times 4, the time, person, place, and situation. Right away, I can tell patient appearance is well groomed and appropriate for the weather outside. Patient's speech is clear and understandable. Patient mood is calm and attentive, and patient build is medium stature, medium height, and medium body build. Okay, all right, so first things first, we're just going to start with the cardiac assessment. I'm going to ask you just a few questions here to get us started. Can you, have you had any chest pain or tightness recently?
Yep.
No? Do you have any history of heart disease in the family?
Not that I'm aware of.
Do you have any swelling anywhere?
Nope.
At all. Okay. All right. So first things first, I'm just going to look here. I'm going to do a quick inspection. I'm just going to go ahead and note I'm not seeing any lifts or heaves. I'm going to look here at the aortic area. That is located on the right sternal border, second intercostal space. And moving on to the left sternal border, I'm going to see the second intercostal space, the pulmonic area, and right below that, the third intercostal space of the left sternal border. I am seeing Erb's point. And at the right below that, fifth intercostal space, we have tricuspid area. Also at the left sternal border, right next to that, left sternal border, mid-clavicular line, we do have, at the fifth intercostal space, we have the mitral area. Okay, and I'm just going to take a quick feel here at the apical pulse. Okay, and I would do that for 30 seconds, and I would multiply that by 2, and I'm measuring 65 beats per minute. Okay, may I touch you?
Mm-hmm.
Okay, I'm just going to feel around here. And I did not note any lifts or heaves. I am not feeling any thrills or pulsations. Okay, very good. I'm just going to take a quick listen here. I'm going to auscultate. And I'm going to be using diaphragm of my stethoscope. Very good. S1 and S2 are normal. No S3 and S4 noted. Now I'll be using the bell of my stethoscope, and I'm just going to be listening for any heart murmurs. Okay, no heart murmurs found, no heart murmurs heard or anything like that. Okay, next thing I would be doing, I'm just going to be doing some percussing. Okay. Okay. Yeah, so next I'm just going to move on to the peripheral vascular, and I'm just going to ask you a few questions. Have you noticed any skin changes recently? Any swelling in your arms or legs? Have you had any leg cramps? Beautiful. All right. So first, I'm just going to I'm going to ask you to just kind of sit up straight a little bit and look towards the left for me. And here I'm just looking for jugular vein distension. No JVD noted. All right. If you look towards me, I'm going to be feeling for your carotid pulse, one at a time. All right. Very good. Very strong pulse. I'm going to go ahead and listen to the carotid, and I'm going to be listening for any bruise. If you will, can you please hold your breath for me? And release. One more. and release. All right, very good, Mr. Richardson. Now, if I may see your, I'm going to just do some, I'm going to be feeling your pulses. So I'm going to see your radial pulse, ulnar pulse, brachial pulse, and the femoral pulse would be located right here where the groin meets the thigh. But for this purpose, I will not be doing it today. I'm going to feel your popliteal pulse. Very good. Posterior tibialis pulse. And your dorsalis pedis pulse. All right, pulse strength is 2+, equal bilaterally on both sides. Everything's sounding really good. While I am down here, I am going to go ahead and check for pitting edema. And I'm going to be doing that in the ankles and shins and top of the foot. I'm going to be holding down for 5 seconds and then releasing to see how the skin comes back. Okay, I'm going to go ahead and check for capillary refill. No pitting edema noted. Okay, skin is dry to touch. Temperature is warm. Skin color is consistent with genetic background. I'm just going to check here on your fingers. Okay, capillary refill is brisk, under 2 seconds. Very good. All right, I'm going to go ahead and actually listen, feel for your radial pulse. And I would do so for 30 seconds, multiply that by 2, and we do have 65. So good, strong pulse, we love that. Okay, yeah, okay, so next we're just going to be doing the abdominal assessment. If you will, I'll have you lie down straight on your back, please. Thank you very much. I'm just going to ask you a few questions. When was your last bowel movement?
Yesterday.
Yesterday? Okay, very good. Have you had any abdominal cramping, nausea, or vomiting?
No.
No. Any dietary changes in appetite?
Nope.
No? All right, I'm just going to take a quick look here. And first off, I'm just noticing I'm not seeing any masses, any lesions. Umbilicus is at midline, which is right where we would like it. No umbilical hernia noted. Skin color is consistent with genetic background. Umbilicus is inverted. All right, now I'm just going to be listening. I'll be using the diaphragm of my stethoscope, and I'll be listening for vowel sounds in all 4 quadrants. Very good. Normal active sounds in all 4 quadrants. I'll be now using the bell of my stethoscope, and I'll be listening for any bruise. All right, very good. No groovies noted. All sounds really good. May I touch you? All right, I'm going to go ahead and just do some quick percussing, and I'll be doing so in 12 areas of the 4 quadrants. All right, tympany does predominate in the abdominal area. All right, now I'm just going to be doing some palpations. And I will be doing so in 9 areas of 4 quadrants. And I will just be noticing my patient's face for any tenderness. I will be feeling for any masses. No masses are felt. No organomegaly. All right, Mr. Richardson, if you will sit up for me, please. All right, very good. Now we're going to be moving to the final area. We're just going to be doing the lungs and thorax. All right, and I just have a few questions for you. Have you had any shortness of breath recently? Any trouble breathing?
Nope.
Do you smoke, vape, and or use pipe?
Nope.
No. Any coughing fits?
No.
Great. All right, perfect. So first things first, I'm just going to be looking here. First, on visual inspection, I am saying that there are no bulges or retractions, no lifts and heaves. Okay, now I'm just going to be feeling palpating area here. And I am feeling for retractions and bulges or bulging. Not feeling anything. No tenderness felt. No crepitus. All right. And if you will, I'm just going to have you say 99 for me.
99.
Again.
99.
One more time.
99.
Beautiful. Tactile fremitus is equal bilaterally, strong on both sides. All right. Next thing I'm going to take a listen to your breathing, and I'm going to have you take a very deep breath in and inhale and exhale with your mouth open, please. Very good. Good. Again. 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 One more time. All right. Breath sound clear bilaterally. I did do that on 8 parts, 4 parts on each side. All right, next I'm just going to be doing a percussing. And I'm going to be doing so also on 8 parts, 4 parts on each side. All right. Lung sounds are resonant, which is exactly where we would like it. Now I'm just going to move on to the back area here, the posterior upper part of the chest. All right, very similarly to before, I am just looking for any lifts and heaves. I'm not saying anything, very good. All right, I'm going to be doing some light palpating here. Going to be feeling for any crepitus, any tenderness, any bulges or retractions. Nothing felt. If you will, say 99 for me.
99.
One more time.
99.
Last time.
99.
Beautiful. All right. Tactile fremitus is equal bilaterally on both sides. And I'm just going to have you take a deep breath in and out. All right. Shoulders are equal bilaterally. Chest expansion is also equal bilaterally. And now I'm just going to do an auscultation. Same thing like we did from before, left to right. I'm just going to have you take a deep breath for me, in and out. Mouth open, please. Again. 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 One more time. Very good. And I would do that 8 times, 4 times on each side. All right. Anterior to posterior ratio is 2:1. Skin is consistent with genetic background. And respiratory rate of the patient is 18 beats per minute. I did take that inconspicuously. All right. And I'm just going to take one final look around. I'm going to do one more thing on the posterior part right here. I'm just going to do a quick percussing from left to right here on 8 sides. All right. Lung sounds are resonant. And everything is looking good. All right. Thank you, Mr. Richardson, for participating in today's head-to-toe assessment.
Thank you.